can't have Heart Smart Health Week without also talking about diabetes, because people with diabetes are at higher risk for heart disease, stroke, and other heart-related, cardiovascular-related events. So this morning we're going to be talking about the ABCs, find out what those are, why it's important to keep those in check. Todd Jefferson joins us. He is a pharmacist with Professional Pharmacy Group. Good morning.
Good morning.
So let's start with the ABCs of diabetes care. A actually stands for the A1C test. Now this is different from the regular blood sugar tests.
The glucose monitoring that you're doing on a day-to-day basis. The A1C test, we ask the patient if they're just newly starting out and they want to get good glucose control. We ask them to do that test at least every 3 months.
Okay.
Every 3 months, and then when the glucose starts to drop. The normal, for a person living without diabetes, it would be 6%. But for a person living with diabetes, it's 7%. So we want lower than 7%.
Yeah.
So gradually, you'll start higher. You're just starting out. You start with your activity, your meal planning, your exercise, daily glucose monitoring to try to get that level down, and over time we see it dropping. It may be 8, 9, 7.5. Don't be discouraged. The whole point is slowly let's make small steps to get that below 7.
Okay, so 0.5% or 1% makes a big difference.
It does.
Okay. Why is it so important that those blood sugars, that those glucose levels stay in check?
We want to make sure that the whole point of good diabetes self-care is to lower your overall risk of complications.
Mm-hmm.
You want to make sure that you reduce your risk of blindness, heart attack, stroke. A person living with diabetes is 2 to 4 times more likely to have a stroke or a cardiovascular event. So we can't completely say that by doing this you're going to remove all your risk. We want to lower your risk back to a person living without diabetes. We want to get as minimum as possible. We also want to think about our kidneys and also the risk of losing our lower limbs or any limbs that we have due to poor glucose control.
That's the thing. These are very, very serious things we're talking about, and you can't undo that damage, so it's better to be in control of it now. The B in ABCs is for blood pressure. How often should that be checked, and what are we looking for in terms of normal range?
We've noticed an ongoing trend with patients now. They want to have their blood monitoring systems at home, so they want to have their blood pressure system. You can do that, but every routine test that you have at your doctor's to get your prescription, they normally take your blood pressure with you. So we ask you, just don't skip your doctor visits. Try to stay on time with them, and if you need to cancel, rebook at a convenient but a quick date. Okay. The target for a person living without diabetes is 130/80. Okay. A person living without diabetes will be 120/80. We call that normal. And some patients always ask me, well, mine is a little bit above 140, should I be worrying about this? Some doctors will give you a time to change your diet, to lower the amount of salt that's in your diet to 2.4 grams or less, or if you had an MI or any angina or heart attack, they may ask you to lower it to 1.5 grams. So in that sense, they ask you to change your diet, to give you a time to ease into everything, so that. And
then if it continues to be elevated, they'll look at some sort of medication. But you talk about the lifestyle changes. These are so key in dealing with these. So C, again, this is another one that can also be controlled by lifestyle. So C is for cholesterol. Why is this important, and what are we looking for in cholesterol levels?
We want to lower the risk of having a cardiovascular event, an MI or a stroke, or a cerebral event as well. So we want to make sure that we keep the cholesterol as low as possible. Everyone talks about the bad cholesterol, the LDL. We want to make sure that keep that below 100 milligrams per deciliter. And once again, you want to know where your levels are at now, so you know whether you can do something about it. Just make sure you get your labs test done. Your doctor will give you the prescription or the lab order. Then go and do it to make sure that you know where you are and what adjustments need to be made. And
one of the things that we've talked about this week already is that for you to take control is knowing your numbers and knowing where you are in terms of your health care. Also, before we're out of time, I just want to mention what's available for diabetics on island in terms of sort of holistic care.
There are, in terms of the dietitians, there are many dietitians on the island that also do tailor-made programs for meal planning and exercise. Then we look at personal trainers. A lot of them will actually give free introductory sessions just to get people more active and know more about how to exercise and to exercise safely. In terms of clinics, most of the doctors will actually say they bring them back to their patients bring them back more often to make sure they're doing good diabetes care. We actually offer diabetes education at this center, but there are other centers that offer the same thing. So there's many things out there. The Cayman Islands Diabetes Association also runs different events where they do some screening and they do education as well. So you just got to keep your eyes out there, because we're constantly going out and doing things in the community.
Get plugged in and get that support, because I think that sort of helps with the overall. If you have a team around you that's helping support you in this effort. Well, Todd, thank you so much for joining us this morning. And we do want to encourage people, make sure that you take control, know your numbers, follow these ABCs, and most importantly, watch what you eat and get moving. We'll be right back with more Heart Smart Health Week.